Hi, I want to take a moment and talk about retroverted uteri. Uteri is plural for uterus, and retroverted uterus is when the uterus is tipped backwards towards the rectum. So imagine this is your uterus. This is Margot, the wandering womb, and this is a side view within the pelvis. So there's many degrees of retroversion, so she can be tipped back slightly or very extreme. She can also be flexed back in like a back bend. And you can imagine when she's flexed back in a back bend, how difficult that would be to get the blood out each month. So she may have more cramping. It would be more difficult to get pregnant when your uterus is in a back bend. It would also affect the rectum. So you may have thinner stools right before your period when the uterus is heavier. And here's another pelvic model with the uterus here, the bladder here. And so the rectum would be right here behind. You can see it deep down inside, part of it anyway. So the uterus here, the bladder, and then the rectum are all structurally and functionally connected. So they affect each other. And when the uterus, again, is tipped back, it can cause constipation and pencil-thin stools depending on the degree. So some women who have a retroversion may not cause any issue at all. And sometimes, depending on the degree and whether it's able to move, it can cause those symptoms I just mentioned. It can even cause what's called an incarcerated uterus if you are able to get pregnant. So you can imagine the uterus being stuck back here towards the sacrum. And as the uterus in the fetus is growing, there's less space to expand, and the uterus can actually become stuck right in that space. And that can be a medical emergency. Now, incarcerated uterus is rare, but it is a medical emergency. So I tell my clients to give themselves at least 3 months of working on the self-care that I teach them to correct their uterus. We also work on some other things, and I'll go over that in another video. I personally corrected my own uterus using these techniques. And so the uterus also has this natural motility, intrinsic motility that all internal organs have, and it's different than a contraction, but it's this motility that happens depending on the time of the month. It's moving in a different way, so it can move in a way to guide the sperm up through the correct fallopian tube to the follicle, so ovulation or during ovulation, or it can contract down or move down during menses, because you don't want the blood moving up. But if a uterus is stuck in any one position, it's going to affect that motility, and therefore the health of the uterus, as well as menstrual health, fertile health, and it can also affect uterine position, as in if it's tipped backwards and it's not corrected, over time the ligaments that connect to the uterus, and there's many of them that contain blood vessels, then the uterus isn't getting fed properly because blood carries oxygen and nutrients, and the lymph carries away pathological debris. Fibrosis can take effect. The ligaments could lose their resiliency, and then over time she could start to fall, not fall, but like she can start to descend toward the vaginal opening, and that's called a prolapse. So there you go. I hope that helps you understand what a retroversion is. Following videos, I'll cover more detail.